Welcome to our training session on infection control techniques. Introduction. Infection control is crucial in home healthcare, particularly for those providing skilled nursing care under the Georgia Pediatric Program, GAPP. This training ensures that caregivers are equipped with the necessary knowledge and tools to prevent infections, protect patients, and adhere to state and federal healthcare regulations. Training chapters. This training is divided into 4 chapters, each covering essential infection control practices. 1. Infection Prevention Control Program (IPCP), the foundation of infection control in home settings, covering roles, policies, and risk assessments. 2. Recognizing and containing outbreaks, identifying early infection signs and outbreak management. 3. Standard and transmission-based precautions, covers hand hygiene, PPE use, and different types of isolation precautions. 4. Environmental cleaning and disinfection, cleaning and disinfection protocols for maintaining a safe home environment. 1. Infection Prevention Control Program (IPCP). This chapter outlines a structured infection prevention plan that aligns with CDC, OSHA, and Georgia Department of Public Health guidelines. Key components, roles and responsibilities, infection preventionists, IPs. Set infection control guidelines and monitor trends. Caregivers, implement protocols, report infections, and collaborate with families. Supervisors, ensure compliance through audits and feedback. Policies and procedures, follow best practices for managing sterile equipment, patient hygiene, and infection reporting. Implement guidelines for caregivers to prevent cross-contamination in home settings. Risk assessment and surveillance. Caregivers should routinely monitor patients for early infection signs, such as redness, swelling, fever, or discharge at catheter sites. Timely reporting of infections prevents complications and hospitalizations. Real-life scenario. A caregiver fails to report redness and swelling at a catheter site at the end of their shift. The infection worsens, leading to complications the next day. Prevention. Caregivers must inspect catheter sites regularly. Document all findings in shift reports. Ensure verbal communication of concerns at shift handoff. 2. Recognizing and containing outbreaks. Early detection and swift containment of infections are critical in home care. This chapter trains caregivers to recognize symptoms and take necessary steps to prevent outbreaks. Key symptoms of infection: fever and chills, respiratory issues, coughing, shortness of breath, chest pain, gastrointestinal distress, diarrhea, vomiting, abdominal pain, skin infections, redness, swelling, pus at wound sites. Neurological symptoms: confusion, headaches, seizures. UTI symptoms: painful urination, foul-smelling urine. Sepsis indicators: rapid heart rate, low blood pressure, fever. Steps to contain outbreaks. Report immediately. Caregivers must notify supervisors of suspected infections. Investigate the source, identify the infection route, airborne, droplet, contact. Isolate the infected patient. Minimize contact to prevent spread. Increase hygiene protocols, handwashing, PPE use, and surface disinfection should be intensified. Real-life scenario: 3 residents and 1 caregiver develop flu-like symptoms in a group home. Actions taken: isolated symptomatic individuals. Provided PPE to all caregivers. Intensified cleaning and disinfecting of shared areas. Outcome: the outbreak was contained within 72 hours. 3. Standard and transmission-based precautions. Standard and additional precautions are key to infection control in home care settings. Standard precautions: for all patients, hand hygiene, wash hands before and after patient care. PPE use, gloves, masks, and gowns as needed. Respiratory hygiene, cover mouth/nose when coughing or sneezing. Safe injection practices, no reuse of needles or syringes. Cleaning and disinfection, high-touch surfaces must be sanitized regularly. Transmission-based precautions, for specific infections. 1. Contact precautions, MRSA, VRE, C. diff, wear gloves and gowns. Clean high-touch surfaces frequently. 2. Droplet precautions, flu, COVID-19. Pertussis, wear a mask within 3 feet of the patient. Isolate patients when possible. 3. Airborne precautions, TB, measles, varicella, N95 masks are required for caregivers. Ensure good ventilation in patient rooms. Proper PPE use, putting on PPE, gown and mask and goggles and gloves. Removing PPE safely, gloves and goggles and gown and mask. 4. Environmental cleaning and disinfection. Cleaning is essential in preventing infection in home care environments. Key areas for disinfection: high-touch surfaces, door handles, light switches, tables. Medical equipment, thermometers, BP cuffs. Wheelchairs. Bathroom and kitchen surfaces, toilets, faucets, countertops. Cleaning versus disinfection. Cleaning removes dirt and debris, soap and water. Disinfection kills bacteria and viruses, EPA-registered disinfectants. Cleaning frequency, daily, high-touch surfaces. After use, shared medical equipment. As needed, immediate cleaning after contamination. Real-life scenario: a caregiver assists a child with IDD who has a cold. Actions taken: frequent handwashing and use of gloves/mask. Disinfected shared toys and surfaces. Educated family members on proper hygiene. Outcome: the infection did not spread to other family members. Conclusion: this training provides caregivers with the tools to prevent infections and protect patients in home settings. By following infection control protocols, caregivers help reduce hospitalizations, improve patient outcomes, and ensure compliance with Georgia's healthcare regulations. Thank you for watching the Infection Control Techniques module. Please answer the questions for this training before moving on to the next training module.